Hi guys, welcome back to DOCSHAALA. So in this video, we are going to see about a important topic, that is jugular venous pressure from the subject physiology. So a question was asked from this topic in the previous exam. So let's just look into the topic now. So jugular venous pressure. So what is a jugular venous pressure? So it is the pressure which we observe in the internal jugular vein. Okay, so it is indirectly observed pressure over the venous system. So it is indirectly observed pressure over the venous system, which is observed in the internal jugular vein. So it is useful in differentiation of different forms of heart and lung disease. Okay, so what is the method by which we observe it? So the patient is positioned in a 45-degree incline and the filling level of the external jugular vein is determined. The internal jugular vein is visualized when looking for pulsations. So a filling of an external jugular vein is determined by looking visually at the internal jugular vein. So internal jugular vein. So in healthy people, the filling of the jugular vein should be less than 4 centimeters vertical height above the sternal angle. Okay, a pen light can aid in discerning the jugular filling level by providing tangential light. So with a pen light, we can aid in discerning the filling. Okay, so here is the point where we can determine the jugular venous pressure. Okay, when the patient is inclined at a 45 degrees. Okay, so the JVP is easiest to observe if one looks along the surface of the sternocleidomastoid muscle, as it is easier to appreciate the movement relative to the neck when looking from the side. So sternocleidomastoid muscle. So when the neck is like this, so this is where the sternocleidomastoid muscle we observe here, right? So it is easiest to observe in this area. Okay, so when we are observing for a jugular venous pressure, I have to incline at a 45-degree angle, but I'm not inclining. That's why I think you may not be able to appreciate it, but this is the area where we can observe it when I'm inclining at a 45-degree angle. Okay. So let's look at the waveform that we can appreciate in a jugular venous pressure. So this is the waveform as you can see in the image, right? So it is having these deflections upward and deflections downward. So the upward deflections are named as A, C, and V, as you can see in the image, and downward deflections are named as X, X prime, and Y. Okay, so it has a biphasic form because as you can see, it is having two phases. So like this. So it is a biphasic form. Okay, so the upward deflections are A. A denotes atrial contraction. So the atria are contracted in here, and C denotes ventricular contraction. Okay, and resulting in the bulging of tricuspid into the right atrium during isovolumetric systole. Okay, and the V is venous filling. Okay, so this is what they denote. Then downward deflections. So one is X descent. So this is X descent. X descent, the atrium relaxes and the tricuspid valve moves downward. And the Y descent, so this is Y descent, where the filling of the ventricle after tricuspid opening is seen. Okay, so let's just look at each one of them one by one so that you can have a medium idea of what I'm talking. So the A wave corresponds to the right atrial contraction and ends synchronously with the carotid artery pulse. Okay, so the peak of the A wave demarcates the end of atrial systole. So this peak demarcates the end of atrial systole. Okay, atrial systole is nothing but atrial contraction. Okay, Then coming to the X descent. So this is the X descent, right? So X descent follows the A wave and corresponds to the atrial relaxation and rapid atrial filling due to low pressure. So X descent first of all, atria contract during the A waveform, and then comes X descent where it corresponds to atrial relaxation, providing the area for filling. So here atrial filling takes place. Okay, then coming to the C wave. C wave corresponds to the right ventricular contraction. Okay, so here the right ventricle contracts, closing the tricuspid valve. So, and the right ventricle, what we have? Tricuspid valve is there, right? Connecting to the atria, connecting to the right atrium, right? So, here, when the right ventricular contracts, the tricuspid valve closes to bulge towards the right atrium. So, the tricuspid valve bulges towards the right atrium during RV isovolumetric contraction. Okay, so in the C wave, what happens? Right ventricle contracts and the tricuspid valve bulges towards the right atrium. Okay, then coming to the X prime descent. So after C wave, what happens? X prime descent comes. So what happens here? So now the right ventricle is in the contracting state and tricuspid valve is bulging towards the right atrium. So X prime results as a descent of right ventricle pulling the tricuspid valve downwards. So this tricuspid valve comes downwards, okay, during the ventricular systole or ventricular ejection. Okay, so X prime is used to measure a right ventricular contractility. That is, this is where the right ventricle contracts to its maximum. Okay, so that it brings the tricuspid valve downwards. Okay, so that is denoted by X prime. Then coming to the V wave, then again the wave is going up, right? So what is V wave? V wave is nothing but here venous filling occurs. Now the ventricle is completely contracted, right? It has reached towards its peak. Then what happens? The venous should get filled, right? So when the tricuspid valve is coming down, it's getting closed. So when it is getting closed, the venous filling happens and the venous pressure increases from the venous return. So the blood from the heart is pumped into the venous system. Okay, then the venous pressure increases in the venous system. Okay, this occurs during and following the carotid pulse. Okay, so that is V wave. V wave is venous pressure. So once ventricle contracts, tricuspid valve comes downwards. Then when the contraction reaches its peak, tricuspid valve gets closed. So when it gets closed, that is when the opening to the internal jugular vein in the heart opens, right? The jugular vein opens, then the blood is pumped towards the venous system directly. Then when the blood is getting pumped into the venous system directly, what happens? The pressure over the venous system gets increased. So that is denoted by V wave in the JVP wave. Okay. Then coming to the Y descent. So you can see the image. There is a Y descent. Now there is emptying of blood from ventricles towards the vein, right? So then comes Y descent. So once it has gone into the venous system, what happens? There is rapid emptying of atrium into the ventricle following the opening of tricuspid valve. That is, once the blood reaches venous system, then again it should, that atrium is getting filled, right? That atrium is already filled. What happens once this ventricle gets hollow, that is, it doesn't have any blood, the tricuspid valve opens so as to the blood should reach from atrium to ventricle, so as to the circulation to go on, right? It cannot stop. If it's stopping, there is a problem, right? So the tricuspid valve opens and the blood from atrium reaches into the ventricle. Okay, so this is denoted by Y descent. Okay, now I think you have understood what all these different waveforms depict. So in a cut short thing, you can just remember like this. Okay, so these are the interpretations that we see, but shall we just go through the waveforms once again? Yeah, I'll just make you go through the waveforms once again. So the A wave is where the atrium gets contracted. So that marks the end of atrial systole. Okay. Then comes X descent. So X descent is where the atria relax. Then atria get filled with blood. Okay. Then comes the C wave. C wave is where the ventricles contract. Okay. When ventricles are contracting, what happens? The tricuspid valve moves into the atrium. Okay. This denotes the isovolumetric contraction. C wave. Okay. Then comes the X prime. The X prime descent denotes the right ventricle pulling the tricuspid valve into the ventricle again. Okay. So during this, a ventricle systole is coming to its peak. Okay. So after this, what happens? What happens? V. That is, the blood is pushed into the venous system but still the tricuspid valve is closed. Okay, so this V form is occurring during the carotid pulse. Okay, then coming to the Y descent, once it has reached into the venous form, we have blood pulled up in the atrium during which X descent, right? During X descent, the atria is already with filled blood. That blood gets emptied into the ventricle. That is denoted by the Y descent. Okay. So I hope now we are clear, right? So let's just go to the interpretations quickly. So a raised JVP and a normal waveform. Normal waveform is what we have seen previously, but a JVP is raised. That is seen during bradycardia, fluid overload, and heart failure. And raised JVP and pulsation is absent. Okay, pulsation, we cannot feel any pulsations. That is during superior vena cava syndrome. And a large A wave. Large A wave, that is, there is increased atrial contraction pressure. So this is seen when there is tricuspid stenosis, right heart failure, or when there is pulmonary hypertension. So you have to remember a few of them at least. Okay. So then a Canon A wave, that is Canon A wave. What is Canon A wave? So during A wave, we have seen that the atrium get contracted, right? But what happens? This tricuspid valve gets closed during this A wave itself. That is atria contracting against the closed tricuspid valve. So this is seen when there is atrial flutter, premature atrial rhythm or tachycardia, third degree heart block, ventricular ectopex or ventricular tachycardia. Okay, absent A wave, that is no unifocal atrial depolarization, that is contraction of atria is not happening. That is seen during atrial fibrillation. Large V wave, that is the venous pressure is getting increased. The CV wave, that is seen during tricuspid regurgitation, because where regurgitation, what happens? The tricuspid valve had to close for the blood to enter into the venous system. But during regurgitation, there is a problem in the tricuspid valve itself. So what happens when there is problem in the tricuspid valve? The venous pressure will not be will not happen in the determined time. It might take longer time to get filled into the venous system. So this is what is creating that large V wave. Then absent X descent. What is X descent? That is where the atria gets contracted. Atrial systole is seen in its peak. So that can also be resulted during tricuspid regurgitation. Okay. Then prominent X descent. Okay. Prominent X descent is seen in cardiac tamponade. Slow Y descent. Slow Y descent is for atrial filling after venous after entering into the venous system. That atria gets its blood pooled into the ventricles. So that is where we see the Y descent. When there is slow Y descent, that means there is tricuspid stenosis or cardiac tamponade. Okay. Prominent and deep Y descent is seen in constrictive pericarditis, paradoxical JVP, or Kussmaul sign. This is important. Okay. Kussmaul sign or paradoxical JVP is when JVP rises with inspiration. With inspiration, the pressure increases but drops with expiration. Okay, with inspiration, the pressure increases but drops with expiration. So this is seen in pericardial effusion, constrictive pericarditis, and also in pericardial tamponade. So this you need to remember. So a question that was asked in NEET MDS exam was, in JVP, A, C, and V waves are observed. Okay, C wave is due to. So C wave is due to. So A, C, V. Okay, so here we have two, right? A, X descent, C, X prime, V, and Y descent. So this is what we have, right? So C represents. Let's see the top options at least. Then I think you can answer better. So the options given were bulging of tricuspid valve during isovolumetric contraction phase, atrial systole, passive filling ventricle, or atrial relaxation. C wave represents isovolumetric contraction phase, right? So there is bulging of tricuspid valve during isovolumetric contraction phase in C wave. So let's just see the C wave once again so that you have an idea. So C wave corresponds to right ventricular contraction causing the closed tricuspid valve to bulge. So tricuspid valve is bulged, right, towards the right atrium during the isovolumetric contraction. So now, are you clear? I think now it's clear, right? So there is bulging of tricuspid valve and also during isovolumetric contraction phase. The answer is A. Okay. So you have to remember this waveforms and what it denotes for. So I think now it has become easy for you, right? So if you like our video, do subscribe to our YouTube channel. You can also follow us on our Instagram handles at DOCSHAALA for dental content and at DOCSHAALA medical for medical content. You can also follow us on our Telegram channel also for more content. Thank you.